Okay, we go to the tongue diagnosis made easy sa kidney disharmonies. Okay. First, we have a patient, male, 25 years old. Pag in-observe po natin yung tongue, the tongue is red and swollen. Wait lang. Think about. Okay, red and swollen indicates that there is a kidney deficiency, accumulation of damp heat in the liver and gallbladder. Next, there is a peel coating, especially in the posterior third, sa likuran po ng tongue, indicating that there is a kidney deficiency. There is also turns in the posterior third, so sa back ng tongue, indicating that there is a kidney fire. There is also a deep vertical crack with yellow coating dito po sa may gitna. So there is a phlegm fire in the stomach. The patient's symptoms is inner restlessness, feeling of heat in the body, vertigo, soft stools, occasional night sweats. There is none sa Western diagnosis and sa background to disease, incorrect treatment with Radex aconitis lateralis preparata. Next, we have a male, 23 years old. The tongue is red, indicating that there is a kidney deficiency. There is also red swollen sides. So sa sides po ng tongue. So this is ascending liver yang. Slightly deviated. So this indicates that there is an internal wind. It is also swollen, red tip, yung tongue. So there is a hard fire. It is also there is also a peel coating, especially in the posterior third. So likod po ng tongue. This indicates that there is a kidney yin deficiency. So symptoms, there is an intense dizziness, feeling of heat in the head, bad mood, smelly, loose stools. Sa Western diagnosis, this one is a vertigo case and background to disease, overwork, caffeine abuse, and emotional problems. Next patient, we have a male, 53 years old. Ang tongue ng patient is pale, red, and swollen. This indicates that there is a spleen-chi deficiency, accumulation of dampness. There is a red center with yellow old coating. So this indicates that there is a stomach heat with phlegm fire. There is also a peel coating and red root. So this one is a kidney yin deficiency with kidney fire. So symptoms, there is paranoia, panic attacks, inner restlessness, nervousness, night sweats, and no drive. So Western diagnosis, there is a manic depression and background to disease, unresolved emotional conflicts, caffeine and nicotine abuse, irregular eating habits, excessive consumption of chocolate and sweets. So sa case history, the patient's first acute paranoia psychotic episode occurred 7 years ago following his final examination as a concert pianist. Since then, this 35-year-old patient spent 2 years in a hospital, sedation with strong drugs, as well as 14 electric shock treatments alleviated the depressive and suicidal mania states. Despite heavy medication, the patient experienced panic attacks every morning and felt severe fright. His sleep was very disturbed. He had great difficulty relaxing, and he complained of a lack of drive and energy. His appetite, however, was good, although he never cooked any food. Rather, he lived off yogurt and cakes. He consumed about 2 liters of coffee and black tea daily and smoked about 40 cigarettes daily. His stools were soft and occasionally sticky. The red, coatless root of the tongue was obvious. His pulse was deep, slippery, and slightly slow. Sa analysis, vigorous heart fire develops in this patient due to extreme emotional pressure while preparing for his examination. The patient was worried that he was not living up to his father's expectation. His father was a famous professor of music. His inability to deal with this situation led to the heart fire, which seriously disturbed him. To this day, the patient feels a lot of anger toward his father, who never showed him the respect he felt he deserved. This led to constrained liver qi, and because of the intensity of this unresolved emotion, this evolved into liver fire. When the liver qi becomes constrained, it control over the spleen becomes excessive, resulting in spleen qi deficiency. This deficiency impairs the transformation and transportation of fluids, which in turn accumulate and transform into dampness. The accumulation of dampness is reflected in the slightly swollen tongue body. Due to the consumption of phlegm and heat-producing foods like yogurt, cake, and coffee, the accumulation of dampness and existing fire generated by the liver qi constraint led to the appearance of phlegm heat, which agitated the heart. When phlegm heat collects and is also subjected to emotional tension over a period of time, it explodes into phlegm fire, leading to extreme emotional instability and manic behavior. There is an alternative explanation for the development of his illness. When liver qi is constrained and the fluids are not distributed, over time it will lead to the formation of phlegm. Long-standing liver qi constraint with the presence of phlegm can develop into phlegm fire, especially when it exists alongside emotional tension and the intake of large amount of heat-producing foods. The phlegm fire is visible here in the dark yellow, old, greasy tongue coating. So, phlegm fire po yun. When the fire is very intense, the patient will glide into a manic phase. When the phlegm is more dominant, the patient will feel more depressed, which is characterized by lack of drive and energy. Besides neuroleptic medication, the patient is also being treated with powerful antidepressant drugs that are responsible for the slow and deep pulse. The slippery aspect of the pulse denotes the presence of phlegm. Both the severe attacks of fear and fright, as well as the medication, have contributed over the years to a deficiency of kidney yin, reflected in the tongue coating without root. When the patient reported that the fears and inner restlessness had again become stronger, the root of the tongue developed an intensely red discoloration. At this point, the kidney yin deficiency allowed kidney fire to arise, which contributed to the agitation of the spirit. Sa discussion, the tongue shape as well as the coating reflect kidney yin deficiency. If the coating is peeled and looks old, this indicates a lack of fluid and kidney yin deficiency. In this case, a new coating was not produced because of lack of fluids and yin, not because of stomach qi deficiency. When a peeled, old-looking coating appears in combination with an intensely red tongue body, the kidney yin deficiency is very severe. So next we have here a male, 44 years old. The tongue is red and contracted. So there is a severe exhaustion of kidney yin, in essence, heat in the blood level. The tongue is dry, indicating that there is lack of fluids. There is also yellow, old, one-sided coating. So there is a stomach yin and kidney yin deficiency with clumping of damp heat in the gallbladder. There is also a flattened and contracted teeth. So there is a heart gene deficiency. Patient symptoms is extreme physical weakness, night sweats, chronic low-grade fever, dry cough, mouth ulcers, and stomach pain. So Western diagnosis, the patient has AIDS, anemia, and Kaposi sarcoma. The background to disease, viral activity, or toxic heat. So next we go to the wasting syndrome. Mr. H, of 44 years old, was infected with HIV 11 years ago. Last year, he developed pneumocystitis carinii pneumonia. When his treatment with Chinese herbs began, his T helper cells count was only 10 microliter. Since then, he felt weak and had a constant dry cough, severe night sweats, and bouts of fever. He lost weight and was very thin, 45 kilograms and 180 centimeter waist. Every 3 weeks, he needed a blood transfusion for his severe anemia. He also complained about painful mouth ulcers. The tongue body was red and contracted. One side of the tongue had an old yellow coating. His pulse was thin, slightly tight, and rapid. Sa analysis, the red contracted tongue body reflects the severe exhaustion of kidney yin and essence. The dryness of the tongue suggests exhaustion of the body fluids caused by the night sweats and bouts of fever. The old one-sided yellow coating underscores the presence of yin deficiency, including the deficiency of stomach yin. The presence of both stomach and kidney yin deficiency prevents the formation of a new coating. The one-sided coating can also be interpreted as a sign of extreme heat in the liver, aggravated by insufficient nourishment of liver yin, kidney yin, and essence. This type of deficiency gives rise to fire from deficiency, which is responsible for the night sweats and fever. Over the long term, this pathology leads to wasting and emaciation as reflected in the extreme thinness of the patient. The pneumonia created heat in the lungs that scourged the lung yin. Although treatment with antibiotics healed the pneumonia at the time, heat and fire remained trapped in the lungs. Consequently, the lung qi did not properly and moisten, resulting in uncomfortable dry cough. Heat in the nutritive level, possibly due to viral activity, may have contributed to the night sweats and extreme redness of the tongue. The accumulation of heat toxin manifesting in the mouth ulcers contributed to the exhaustion of the patient and his general feeling of sickness. The thin and rapid pulse was an indication of general yin deficiency and resulting heat. Okay, here is the tongue picture before and after treatment. So there is improvement of the tongue. So treatment, the purpose of the treatment was to nourish the yin and enrich the kidneys, resolve the heat from deficiency, and clear heat from the nutritive level. The foundation of the herbal prescription was drain the white powder prescribed to drain constrained heat from the lungs. Herbs were added to resolve the heat from deficiency, tonify lung and stomach yin, and stop the coughing. In addition, the qi and blood were gently tonified. For 12 weeks, the patient took the following decoction with slight modification: cortex mori albe radices, cortex lyci radices, honey toasted radix, glycyrrhizae uralensis, plastrum, tostudenis, tuber, Ophiopogonis japonisi, radix adenochlorae, and so on. So, ang dami po. The night sweats and fever responded quickly to the treatment, and the cough improved after a few weeks. The patient gained 5 kilograms, about 11 pounds, and did not require any more blood transfusion. Slowly, the tongue lost its red color. It is now less contracted, and a new coating is forming. Besides treatment with Chinese herbs, the patient later underwent a newly developed form of chemotherapy. So next, we have another case of a male 65 years old. So let's observe the tongue. There is a red film. It is red, firm, and stiff, indicating that there is a kidney yin deficiency with internal heat. It is also dry, so there is lack of fluids. Yellow old tooth-like coating, so there is a stomach kidney yin deficiency with heat accumulation in young brightness organ stage. So sa symptoms ng patient, there is loss of memory, severe headache, fever, occasional night sweats, constipation, and vertigo. Sa Western diagnosis, the patient suffered strokes 3 days before. Sa background to disease, smoking cigarettes for 30 years and alcohol abuse. Special tongue shapes associated with kidney yin deficiency. A pale, hammered shaped tongue represents severe exhaustion of the qi in the middle burner. A red hammered shaped tongue is indicative of severe exhaustion of yin. Severe long-term emotional problems, irregular eating habits, or excessive sexual activity can each lead to exhaustion of qi and yin. As discussed in Chapter 2, a deficiency of yin and essence may manifest as a depression at the root of the tongue. In red tongue, this pathology shows itself occasionally in a contracted tongue root. This is a sign that the yin strength is diminishing. It is important to remember that the root of the tongue represents the strength and vitality of the kidney energy. So we have here a case of a female 29 years old. The tongue is pale red and hammer shaped. So there is a spleen qi, kidney yin, and essence deficiency. The tongue is also red on the anterior third with red points. So there is a presence of heart fire. So symptoms, there is restless, fetus, slight uterine bleeding, 8th week of pregnancy. There's also low-grade fever, insomnia, nervousness, inner restlessness, panic attacks, pain around the kidneys, and lack of appetite. So Western diagnosis, there is habitual miscarriage, acute threatened miscarriage, and underweight. Sa background to disease, unresolved emotions due to suicide of mother, insufficient intake of food and drink, DNC twice. Next, we have a male 35 years old. Okay, the tongue is red and swollen, so there is accumulation of damp heat. It is also contracted. There's a contracted root, so there is a kidney yin and essence deficiency. There is also a yellow thick coating at the root, so there is accumulation of damp heat in the lower burner. Symptoms, occasional burning sensation with urination, smelly, soft stools, dry cough, exhaustion. Sa Western diagnosis, there is a chronic prostatitis, and sa background to disease, drugs and alcohol abuse, severe demands at work. So next, we have a case of a female 33 years old. The tongue description is pale red and swollen edges. So there is a presence of spleen qi deficiency. There is also a contracted root with thin yellow coating. So there is a kidney yin deficiency with accumulation of damp heat in the bladder. So some symptoms of patient, there is frequent and urgent urination. There is insomnia, night sweats, depression, feeling of pressure in the stomach, epigastric fullness. So Western diagnosis, there is a chronic cystitis. And sa background to disease, there is irregular eating habits, lack of sleep, overwork, unresolved emotional problems. Next, we have a male 63 years old. So, ang tongue po niya is reddish long, soft body. So, there is an intense heat injury, injured the fluids. There's also a red edges. So, this indicates heat due to liver qi constraint. There is also a yellow greasy coating covering the anterior third of the tongue. So, there is a presence of damp heat lodged in the intestines. The patient symptoms, there is a smelly soft stools with pus and blood, urgency and defecation, borborygmus, abdominal pain, severe loss of weight, and there is a poor memory. Sa Western diagnosis, there is ulcerative colitis, and sa background to disease, alcohol abuse, excessive consumption of fatty greasy foods. How is the tongue coating formed according to TCM theory? The tongue coating is a layer of material on the surface of the tongue. According to TCM theory, the tongue coating is created from the rising and evaporation of stomach qi. Spleen and stomach qi evaporates and steam the food turbidity from the stomach upward, where it condenses on the surface of the tongue. Wu Kun An noted that the tongue has a coating just like the earth has moss. Moisture arising from the earth gives rise to the growth of moss. The stomach vaporizes the spleen's dampness, which rises upward to appear on the tongue coating. The normal tongue coating is thin, white, moist, and evenly distributed. Maybe slightly thicker in the middle and rear areas. When the stomach qi is sufficient, there is a coating on the tongue like a layer of grass growing on fertile earth. When there is a failure of the stomach qi, there will be no coating on the tongue. So next question, what is the relationship between the tongue and qi, blood, and body fluids? The tongue is a muscle with abundant blood vessels. It depends on qi, blood, and body fluids for its nourishment. The tongue body shape and color is dependent on the quantity and circulation of qi and blood. When the qi and blood is sufficient, the tongue body shape is normal with a pink color. If the qi or blood is insufficient, the tongue body will shrink in size or become pale. When the circulation of qi and blood is smooth, the color of the tongue body will be normal and maintain its proper shape. But if the circulation is impaired, it will appear purple or develop purple spots on the lateral margins. If the qi and blood overfills the tongue body, it will become swollen and red or crimson. The moisture of the tongue body and coating depends on the status of the body fluids. Acupoints and HN20 are two holes beneath the tongue through which saliva is secreted. According to TCM theory, spittle is the fluid of the kidney and drool is the fluid of the spleen. What are considered body fluids? The generation and distribution of fluids depends on the functioning of the sanqu organs, especially the kidney, spleen, and stomach. By observing the moisture of the tongue body and coating, we can assess the status of the body fluids and any pathogenic heat that may be consuming them. So, next question, why examine the tongue body first and the tongue coating second? In the clinic, when we examine the tongue, we should first pay attention to the tongue body and then the tongue coating. The tongue body is anatomically deeper. It is both a muscle and a sensory organ with abundant blood vessels. When it protrudes outside the mouth for too long, the blood vessel will overfill and the tongue color will take on a light purple hue. The tongue coating, however, lies superficially on the tongue and is easily observed. Unlike the body of the tongue, the coating does not change after a long period of exposure outside the mouth. So it is best to first observe the tongue body and then the coating. To obtain the most clinically relevant information from the tongue examination, do not let the patient protrude his tongue for over 30 seconds. Allow the tongue to maintain inside the mouth for 3 to 5 minutes between periods of protruding and observation. Okay? So how can one differentiate the physiological congenital cracks on the tongue from pathological cracks? Cracks in the tongue body do not always accompany pathological change. 0.5% of the general population has a congenital cracks on the tongue. Congenital tongue cracks are usually coated inside, and there are no concurrent symptoms or complaints. The pathological cracks, on the other hand, are usually accompanied by other complaints as well as a lack of coating inside the cracks. So next, what is the pathogenesis of the male pale tongue with yellow greasy coating? When the appearance of the tongue body and coating do not agree, we should analyze the etiology and pathogenesis of each to determine the diagnosis. When a patient has a pale tongue with yellow greasy coating, the pale tongue mostly indicates deficiency and cold. However, a yellow greasy coating indicates damp heat. Although the tongue body and coating indicates cold with heat, the tongue body mostly reflects the condition of antipathogenic qi, and the tongue coating reflects the pathogenic factors. So, tandaan po natin yan. Thus, this tongue would suggest deficiency cold of the spleen and stomach with accumulation of damp heat. The root is deficiency and the branch is excess. This is therefore a complex pattern of heat and cold. Damp heat may arise from either the accumulation of dampness transforming into heat or from a direct exopathogenic attack of damp heat. So next, what is the pathogenesis of a deep red tongue with greasy white coating? A deep red tongue usually indicates the presence of internal heat, while a moist greasy white coating may be caused by accumulation of cold dampness. Thus, a deep red tongue body and a greasy white tongue coating reflects two opposing pathological changes, the heat and cold. There are two situations that may create this unusual pathological phenomenon. The first is exopathogenic heat invading the nutritive level while there is accumulation of cold dampness remaining at the qi level. When the exopathogenic heat invades the nutritive level, the heat consumes the blood and body fluids. This causes the blood to become more concentrated. As the concentrated blood fills up the blood vessels of the tongue body will become deep red in color. Meanwhile, there is an accumulation of cold dampness in the qi level. This pathogen may pre-exist or attack the body and combine with exopathogenic heat. The turbid cold dampness is steamed upward by the stomach qi and condenses on the surface of the tongue to form a greasy white tongue coating. The second possible explanation for this presentation is when a person with constitutional yin deficiency with empty fire is attacked by cold dampness or food stagnation. Because blood is a part of yin and body fluid, when the yin is deficient or exhausted, the blood will concentrate and manifest on the tongue with a deep red color. Because the deficient yin fails to nourish and moisten the tongue, may also appear small and dry. On top of this yin deficiency, cold dampness can attack, or the patient may have an improper diet that leads to food stagnation. The turbidity thus formed is steamed upward by the stomach qi and deposited on the tongue surface where it forms a greasy tongue coating. Since deficiency heat is not strong enough to transform the color of the tongue coating from white to yellow, it remains white. When changes in the tongue body and coating do not agree, this usually indicates that there are two or more pathological changes occurring simultaneously in the body. In such cases, the circumstances are relatively complicated. The appearance of the tongue can summarize these changes. So, thank you for your attention.